You and I have gone down the rabbit hole on the FDA's attempt to try and regulate and rein in big industry like big pharma and big medical. And I know I've told your listeners before, over 90% of the products in the operating room have never been through an FDA human safety trial. It was an entity built at a time to serve a purpose. And I just think they're drowning. I think there's a lot of industry influence and spit being swapped that can skew decisions and viewpoints, and that's dangerous.
It is dangerous. It's dangerous and it's spooky that you get pushback after that. So let's talk about the pushback, because it was immediately afterwards you started texting me like, dude, holy shit, these hit pieces are nuts. Because you could see the machine moving against you. So you could see that someone saw this Senate hearing, realized that it could potentially have an impact, and tried to do their best to mitigate those potentially positive effects for the health of American people. But it could cost them money. So they started pumping money into these media outlets.
Absolutely. And this is what I've seen before, owning a compounding pharmacy. When I went on Jillian Michaels' podcast, she is very opinionated and passionate about this. And it took me 10 minutes to explain to her that compounding pharmacies aren't bad guys. And because she had only heard the corporate media narrative of compounding pharmacies are dangerous, people are getting drugs from these compounding pharmacies that are in garages, and they're just willy-nilly making compounds and shipping them into the marketplace. And I had to methodically walk her through. Compounding pharmacies fall under the FDA's jurisdiction. My pharmacy's been inspected 3 times in 18 months. Every single ingredient we buy is an FDA-approved ingredient. Every single compound we send off to an independent third-party lab to verify, okay? And I say all this just to lay the groundwork. We've treated over 1 million patient lives at our pharmacy, over 1 million patient lives nationwide, and what they do in that environment is the media will list any recall, any mistake a compounding pharmacy makes, but sweep under the rug that big pharmaceutical companies like Eli Lilly and Pfizer have moved most of their manufacturing overseas, where the FDA has to submit before they can come do an inspection and has to give them 2 months notice because they're coming into a foreign country and they've got to get visas and approvals and all these things to come inspect those facilities. They can't just walk in like they walk into my facility. And so Eli Lilly in particular, one of the reasons they're struggling with back orders right now is their facilities have been popped for egregious action by the FDA. But none of that is in the public eye. You have to scour. I think Reuters is the only one that wrote an article. But little compounding pharmacy in Texas recalls 28 vials proactively for a mislabel. And the New York Post makes it national news. But you didn't cover Eli Lilly's nationwide issues on all these products, or the fact that over 2,000 manufacturing facilities owned by Big Pharma haven't been inspected in 5 or more years. It's just not good journalism.
Well,
it doesn't have integrity.
To that $8 billion. That $8 billion has an effect. I'm sure these journalists aren't sitting there watching this Senate hearing going, you know what, I'm outraged. I feel like these people are full of shit. I'm going to help the American people and write this piece criticizing it. No, they're probably being instructed.
Well, she sent us and said, it was very vague. I get a voicemail. We want to write an article on your pharmacy. I find out at 3:00. I'm in meetings. We draft a response explaining all the things we do to go above and beyond, and how our vision is to bring, cost-effective prescription drugs to the American people for pennies on the dollar, typically less than your copay or deductible. What part of that? And in this article at the end, I shit you not, the girl puts, and by the way, Eli Lilly slicing prices by 50% on their weight loss drug. That's how the article ends. And I'm like, how is this not an advertisement? And so I looked, and now that I've seen it when I was a drug rep, I saw it when I owned pharmacies and labs, I saw it as a device rep, but I went and looked and said, okay, who owns the New York Post? And when you peel back the layers to that onion, the New York Post majority holders of stock are Vanguard, BlackRock, State Street. Now, let's go look at who are the majority owners into Eli Lilly. Vanguard, BlackRock, State Street. So the same folks who own the pharmaceutical companies, who have the most to gain by keeping the narrative the same and driving America towards the chronic disease crisis and monetizing your chronic disease with all the things you and I have discussed before, whether pharmacy benefit managers, insurance companies, hospitals, pharmaceutical companies, front to back, top to bottom, we've lost our way. We really have lost our way, Joe. It's all about quarterly earnings and quarterly profits. And I'm not saying that they're intentionally poisoning the American people to set them up so that they can knock them down. I just think it's so siloed and so compartmentalized, and everybody's fighting for that extra dollar, that quarter, that day, that month, that they're just blocking and tackling and preventing the narrative from rising in their siloed bucket. But you have to, like in humans, we have to take a look out and go, hey, I'm not just treating your knee or your brain health or your heart health. The body is an organism that works together. We have to do a deeper dive to assess where the disease started, what caused it, and can we uncover the root cause and fix the root cause. We have to do the same thing in our systems and our protocols and our procedures. We know that corporate capture is real. We know that corporate capture has somewhat happened with the FDA, somewhat happened with Congress and the Senate. You know, everyone's scared to fight these guys, and they can wreck your lives. It's scary, and it's hard to fight when they control the media. They control all the funding to the advertising on the news networks. God. I mean, good luck getting a story out there.